Hi, hope you're all well on this Bank Holiday Monday in the UK. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And tonight, myself and Dr. Sunny Dhesi, we're continuing our weekly series of lives talking to different practitioners from around the world. Hi Sunny and hi Martina. I think Balsam's joined us as well. And hi Rochelle, hope you're doing well. I'll just invite Sunny. We've got Dr. Martina Lavery, who's a dentist from Australia, from Sydney in Australia. I'll just invite Sunny. I'll just get Sunny first, Martina, and then you can join up in a second. Hi, Sunny.
Good evening, Viv. How are you?
I'm fine, thanks. How was your Bank Holiday Monday been?
It was very good. We did a cultural visit to Cambridge.
Right.
So, yeah, no, it was very good. A little bit of fact finding. I even took some time to check out Cavendish Clinic as well in John Lewis. So
right. What did you think of it?
Well, I to be honest, I just went in there and took their price list, but
right.
It was interesting to see the setup that you could join the Cavendish Clinic from the outside, from the high street. It had almost like its own separate entrance, but there was also an entrance in John Lewis as well, and it's positioned within the beauty area and sort of tucked away. But yeah, very interesting, very interesting. Hi, Martina. Good evening.
Good morning.
Oh, good morning. Yes. Good morning.
Good morning.
A very early morning.
It's very kind of you to join us at 5:30 in the morning in Sydney. I've got to really thank you from both of us, Martina.
Oh, no. Thank you so much for the opportunity to talk with you guys. It's lovely.
Oh, you're the second practitioner from Australia. We had Jake Sloan on last week, and you know him well from training, I think, a few weeks back. Yes. But we'll talk a little bit about yourself, about your background. I'll let Sunny handle it if that's all right. Sunny can go through a little bit about the background of your story in aesthetics, Martina.
Absolutely.
Well, Martina, over to you, really. So we always like to start off with a bit of background about yourself, your journey into aesthetics from a more conventional sort of traditional medical field, and then where you're at now, so sort of past, present, and then future. So yeah, everyone watching will be really interested, I'm sure.
Now, how long does this live go for, Sunny?
As long as you want it. As long as you want it. You're the guest. You're the guest.
Yeah, so I'm actually a UK graduate. So I actually graduated from Northern Ireland in Queens a long time ago, 1998.
Okay.
And I was given the opportunity in my final year to study forensics. So I had a forensic scholarship to Adelaide in South Australia. And I actually met my husband there. And we came back, he's a dentist as well. And we actually came back and worked in Manchester for a while. And then we decided to go back to Sydney. So I've been in Sydney since 2001.
Yeah.
And worked as a general dentist, was in a partnership practice. And then like all good things, I actually fell into aesthetics. So as a dentist, I was constantly thinking about bruxism.
Yeah.
And seeing the presentation of bruxism, although, it seems to be much, much more prevalent these days, probably post-pandemic. And I was doing all of the treatments to alleviate pain and try to minimize bruxism. But then I came across the injectable pathway of masseter reduction using toxin. And it really ignited something in me that I just loved. I just loved it from the minute I started. And so, we were getting good results, and then patients would say, oh, well, what about here and here? And I thought, well, if I'm going to carry the drug, I need to know lots about it. So I delved into lots of study, and I actually, wanted to really know where that needle was going. So I actually studied dermal therapy. And then I've just graduated with a Master's of Facial Aesthetics from the UK last year. And my thesis was on the treatment of lower face laxity. So when I talk about aging and rejuvenation, I talk about volume loss, I talk about surface changes, and laxity of the skin.
Awesome.
So I think if we approach aging with those three pillars in mind, we can be pretty comprehensive. So that's really it in a nutshell. I've opened up, I've worked by myself in my own clinic for about 7 years, but we've just recently relocated to a new clinic. So I'm working hard at that and enjoying not having any formal study at the moment, but you know, every day is a learning experience.
Definitely.
And that's led me into ultrasound.
Definitely. So before we get onto the ultrasound, I've got a question that I think anyone watching this back or watching it now will have. Most UK graduates, and I can probably guess the answer to this question. Most UK graduates, they'll go to Australia and then they'll come back rather than staying out there. Now, was it down to your husband being Australian that you stayed out there, or is he UK? Is he from the UK as well?
Australian.
He's Australian.
Yeah,
so is that the reason why you went back, or is it because I love Australia?
Look, I think obviously it was because of my husband being Australian that we came back here.
Yeah.
But it's an amazing country. And I think, you know, we've had a wonderful life here. I've got 2 boys. Their lifestyle is very outdoors. They're cricket mad, as is my husband. So I think our lifestyle has been amazing here. And also, I think for me, it was such a liberating experience coming from working as a national health dentist.
Yeah.
To, you know, want to do a treatment plan and not seek approval to put like a white porcelain crown on a tooth. So it was very liberating to work here initially, especially as a younger person. You know, it's 20 years ago now. So I think the work as a dentist, which was a huge part of our life, of course, our professional life, was really nice. It was very refreshing, actually.
That sounds very attractive. So Viv is eager to ask this question, so I'll ask it for him. So,
it's just that I came across Martina, I think it was probably a year ago, when you very kindly recorded a Christmas greeting for a series of video that I did last year. And I've got to thank you for that, Martina.
No, Viv, I came across you because I was absolutely blown away by your ability with graphic design and all things IT, all things that I am not, Viv. So, you know, I was amazed, and all of the things that you're able to do with the CGI, it's just phenomenal. I just wonder, like, do you sleep, Viv?
I'm writing. I do sleep sometimes. I'm writing an article in the PMFJ journal about the CGI work that I've been doing, so that will hopefully be published in the next few months. So that's something I'm looking forward to, talking about the CGI work that I do. But we'll talk more about you, Martina. We'll talk a bit more about what you do. You implement technology really well in your dental and aesthetics work. You've recently introduced 3D CT scanning for patients, particular problems with gagging. I think that's what you mentioned in your post. How did that come about? And how did also your journey into the start of ultrasound come about, basically?
I think it really has to go down to what kind of practitioner you want to be and the experience that you want your patients to have. And I think that, you know, technology for me is scary, actually, I have to say. It's not an innate thing like you, Viv. I have to learn it. I have to literally step 1, 2, 3, and then I can do it. But I think, you know, we have so many limitations using conventional diagnostic tools. So the diagnostic 2D image, you know, where you bite down on a little X-ray film inside your mouth, yes, it provides us with a lot of information, but there's more information we can gain, and there's better information, and it can improve the patient's outcome. And I've just embraced it, not through my love of technology, but because I just believe we can be better. So 3D imaging in dentistry has been around for a long time, and it's probably more associated with dental implants and surgery, because obviously you need to know all of those anatomical features, particularly nerves and blood vessels, if you're going to be drilling the jawbone. But, you know, now we really, sometimes you just need more information. So I think it's about information finding.
Yeah. What
And
do you...
also, sorry.
No, carry on. It was just really, I was just wondering what your patients think about that. Your
Okay.
grasp of initiating the use of technology in your work. What do your patients think of that?
They love it. They really do. Like, they are really impressed. And I think it's been a beautiful journey as a dentist, because I have worked in the same area for 20 years, as I'm sure, you know, for the same of you guys. And, you know, just to see the patient journey with me over 2 decades, and seeing, you know, a grandmother in a family, and then seeing the daughter and seeing the grandchildren, seeing that third generation. And they've embraced this story with me as well. Like, the journey that I've had in my career has been because the patients have, you know, been on that journey with me. So I think they're really impressed. It's really funny, because actually one patient said, "Can you afford all of this? Like, are you okay?" And I'm like, "Well, we'll be okay. You know, we'll see how we go." Because it's not cheap, right? It's not cheap to invest. So I think the investment, the outlay, the training, it's not about buying a machine, is it?
No.
You buy the machine can sit in the corner and collect dust, but you really have to invest in your own training. And I think patients are loving it. I think they're really enjoying not having to go elsewhere, because before I would refer them to radiology. So I think they're really enjoying that aspect of it, that it's on site. For me, I just love having the ability to diagnose pathology. And, you know, not everything is routine. So I think the
Martina,
more...
I mean, that's a testament, a massive testament to your patient approach. The fact that you've got generations of patients under your care. Jake mentioned, and forgive me if it's a bit controversial, but Jake mentioned Jake Sloan, that in Australia, that dentists unfortunately fall into a bit of a grey area in aesthetics. Now that we've got a dentist on with us now, could you just explain that a little bit further, your viewpoint about aesthetic medicine, obviously dentistry, and maybe perhaps dentists falling into this grey area that Jake was mentioning? Is that something that's real, or?
Yeah, look, I think it is a grey area. I think it all boils down to scope of practice. And I think, you know, staying within your scope. So I think scope of practice is a very individual scope of practice. So I think competency is very hard to assess, isn't it?
Yeah.
You know, you can have someone who perhaps is a nurse or doctor, but are they competent? You can have a dentist, and are they competent? So competency is very hard to measure, but I think being able to demonstrate the ability to have good training, and that, you know, you are working with within the boundaries of what you're trained for and what your skills match up for, is very important to demonstrate.
No, definitely. So we've touched on ultrasound a little bit. Obviously, we're all new to it. And the theme that's come across everyone that we've spoken to is that there's no standardization globally. There are people who are specialists in it. They're even radiographers who are specialists in imaging, but not necessarily facial aesthetics and ultrasound. Where do you see ultrasound at the moment in your practice, and maybe in Sydney itself, in terms of the approach that you're taking?
I just can't believe that I was doing injectables without it. No, to be fair. I went along to a course a few months ago. I've actually got 2 radiologists in my family.
Right.
So I have been able to pick their brains. But again, it's quite, not rare, but it's uncommon for facial assessment through ultrasound. But I went along to a course a few months ago, and I really thought, I would love to know more. I would love to be better, and I would love to be safer. That's just the fundamental way that I think about practicing. And I felt overwhelmed, to be honest, because I didn't have any background knowledge at all. And I thought, gosh, how am I ever going to be able to understand these black and white images on the screen? But really, at the end of the day, it is just about pattern recognition, I think. And then I had a light bulb moment, and I thought, well, I'm forever looking at black and white images, but they're static. So it's just really about training the brain and the eye to recognize patterns. Now, I think you can't do that by yourself. I think there's been great training that I've attended recently here in Sydney, which has had an online component to it. So you actually have to do some pre-recorded webinars for a few hours. I think it's 5 or 6 hours. And it really came together for me doing that. And I've realized that it's just about practicing, and that those images 3 months or 4 months ago that I really thought I won't know how to do this, they make sense now. Yeah. And it's been quite interesting implementing it into the practice, because it's another layer of the patient wow factor. Why you really are taking this seriously. And I think patients appreciate that you're always undergoing professional development, and that you're always trying to do things in a way that is gold standard for them. But I've used it pretty much every day since completing that course in some way or another, like scanning my boy's face. I mean, they think I'm silly and strange anyway. So coming home with ultrasound devices is just like another layer of craziness. But yeah, just getting the opportunity to scan an area, recognize, and it all does make sense when you understand the physics. I mean, I'm absolutely no expert, and I'm still learning, and I'm really embracing the learning and can't wait to learn more. But I think it's just been absolutely brilliant. And I actually really think that it has been easier to do than I initially thought, actually. Would you feel the same way, guys?
I went to training with the Academy of Regenerative Medicine in the UK earlier in the year, and it was a group of practitioners. It was a small group of about 7 or 8 of us all together, and we were learning about using the technology, carrying out scans, guided ultrasound technique, and I was using the scanner earlier in the year, so I had a little bit of practice myself, and it was I was a bit lucky in that respect that I'd had some practical training myself initially by myself, and it did help me. It was easier to follow the learning and the training that I went through because of a little bit of experience doing things myself. But every day I'm still learning. I'm by no means an expert, but the CGI work that I do gives me an appreciation of understanding anatomy in a different way. You can't just learn from textbooks because everyone's so different.
That's right.
No, exactly. And the same for me, Martina. I've not done any traditional learning, obviously discussing with Viv, doing his ultrasound, but every day, every time that we're doing fillers, it's now a standardized approach, 5-10 minutes of just scanning, vascular mapping everywhere. But now I've started getting into the habit of just talking to the patient about the different layers. And now some of my clients are coming back after maybe a year and a half or 2 years. And, you can visualize muscle and filler because you know where muscle should be. And if there's something there that, you can differentiate between muscle and filler, I mean, they're astounded, especially when you're doing cheeks. I mean, cheeks is one thing that patients and clients are always worried about. Like, I don't want to look like a chipmunk. And increasingly, without ultrasound, I wouldn't have known that filler was there already, and that you're actually just having to use like 0.05 of a mil just to supplement what's already there, rather than putting the standard MD codes amount or whatever you want to subscribe to. So definitely. One of my questions was going to be, now obviously you've done a MSc in facial aesthetics. Was that where did you do it? Just for people to be interested in knowing where you've done it.
Prof Ali Ghanem was the lead there.
So which university? Which university did you?
Ulster.
Ulster. Okay.
With Birmingham.
With Birmingham. Okay.
Yeah.
And was it all distance, or did you have to attend as well?
Yeah, I had to attend as well.
Okay.
Amazing cadaver dissection as well. But I think that's just one thing with the ultrasound. It's just even if you're not going to use it for injecting, just anatomy visualization. I just think my anatomy knowledge has just gone through the roof since doing ultrasound, because that ability to see it real time,
exactly,
and just the understanding of the different layers, and that we're all very unique in our anatomy, and actually what you said, Sunny, where you didn't realize there was filler before, and then you can see it and you realize, wow, this is, this filler's been there for a while as well. That's really interesting.
Exactly.
What would you say? I'm just going to ask Martina, for practitioners that may be watching and thinking, well, I'm considering maybe doing some training just to find out about the whole world of ultrasound use in aesthetics. I don't intend to buy a scanner just yet, but I want to find out more about it. What was your experience of the cutaneous training with Peter and Jake, who'd organised it? How did you find that training as pretty much a beginner in the whole world of ultrasound, Martina?
I think that training is just phenomenal. I think that the expert knowledge that Peter and Tatiana shared with us, and thanking Jake for facilitating it and making it such a lovely, safe learning group, was really appreciated by all of us. But I think the way that it was set up, having the pre-learning, so I think it gives you a taste for it, and whether you feel that you're out of your depth or whether you feel that it's something within your capability, I think that quickly becomes apparent during the online learning. And I think the online learning is brilliant, because I just even went back on Sunday and thought, if you guys start grilling me, I better know a bit more of my terminology. So, better swat up. So it's there for you. It's a really good investment of time and money. I think it's actually quite affordable course, given that we're trained by, pioneers, literally pioneers in this field. And they just share their knowledge so generously, so unassuming, and there's absolutely no judgment. I mean, I'm sure the things that we were saying to them as a group, the questions, inside their heads, they probably were having a bit of a chuckle, what are these practitioners and what is their intention with ultrasound, because they're coming out with some strange things. But just to have them there right beside you, hand holding literally the device and telling you and showing you anatomy, and also they were so humble And actually, you know, even acknowledge, oh, when they put like the probe, because my zygomaticus major is not where it should be. It's really, really lateral. So I was a bit of a mystery in that course and on a previous course. And, you know, even for them to be so honest and humble and just say, hey, what the heck, you know, what's going on here? You know, I'm not doing a very good accent, but, you know, what's going on here? And, you know, this is not quite right. And I don't have all the answers. And I think just marrying that up with a full day, like it's an intense day, a full day, but I just loved it. I would have loved to have been doing another course the next day, actually, just to really cement what we learned. And then they do like a little quiz at the end where you can win some cookies. So yeah, it's just fun. It's a very safe, no judgment, and I would highly recommend people go along to it. And as I said, I just love the ability to refresh your knowledge. And it's also, you know, there are lots of ultrasound courses, because I've looked at actually doing, like, say, a diploma, just to have paperwork, because I think it's important to have some formal documentation of things, because where do we get that as you said, Sunny, like there's no standardization.
No.
But those courses are all on musculoskeletal, they're on abdominal, they're on obstetrics. That's not helpful. So really, and also, you know, they didn't spend a lot of time on the physics and terminology, because that's almost assumed learning when you go on the day course. So I think the way that they've done it is brilliant. And I would love to head across to the Netherlands and do some more, actually, with them. And I think it just makes you realize that you can actually learn it. That I was initially very overwhelmed and thought, oh, no, I don't think I'll be able to do this. I won't know the structures. But it's just time spent. And I think if you're keen and you're curious and you're wanting to elevate your aesthetic practice, I think it's an important step.
Yeah. Yeah.
Oh, I think we've got a quick question from, because people are watching. So everyone is watching. Is it Marianne and Inspired to Stand Tracy, I think, is probably watching. This is the cutaneous course that's run by Leonie and Peter, that's based in the Netherlands. They have an online course as well, which I'm going to be doing very soon, but is very good. Viv, I'm going to beat you to a question, if that's okay, because I'm just conscious of time. Martina, you've got your new practice has opened in a new location. What does the future hold for you in your aesthetic practice? What are you hoping for?
The iceberg, really.
Yeah, go on.
I think that the practice will just continue to grow. I think word of mouth is everything in practice. So we've got a very good reputation as one of the better clinics in the area. And I think probably just being able to continue to do what we're doing now, and growing as a team. And I think, you know, perhaps onboarding some extra staff eventually down the track. But, you know, I think we forget about the moment that we're in right now.
Yeah.
Where I sit right now in my professional career, and I'm very grateful for, actually. And I think we're always thinking of the future and more and what can we do. And I think it's important to embrace the now and realize that life's good.
Perfectly said. Perfectly said. Go on, Viv. I'll let you wrap up.
It was just recently, I think within a week or a couple of weeks ago, you were at a beauty expo talking about teeth grinding and masseter reduction and the problems that patients have with stress. And I think you asked me a couple of weeks back, Martina, if I had a meme to send you that you could use for this presentation. So you've got a big interest in masseter treatment, masseter assessment. So what I thought I'd do quickly, I know we're short for time. It was
the end, Viv. Is this a test?
No, it's
You
not a
won't take
test.
it, don't worry,
It's purely a scan, a masseter scan. This one was carried out by the radiologist Carolina Mary Lewis. It's a longitudinal masseter scan of the patient to show on ultrasound what masseter movement looks like, dynamic masseter movement. And what I'll do, I'll let you have a look. This is the original scan that she carried out. Now I'll show you the CGI work that I did on it. It's really just to show what can be done with technology these days. That's the same scan carried where I've used CGI computer graphic technology to augment it, to let you see more clearly exactly what you're looking at. And
You're amazing, honestly. And I think your ability to be able to do that, to show that to patients, it just makes so much more sense when you've done this, Viv.
It just makes things easier. And again, as I mentioned, I'm writing about this for a publication in a couple of months' time. That was by Carolina Mary Lewis, radiologist from Argentina. And we can't do a live without mentioning the one and only Leonie, Dr. Leonie Schelke. So here's one by Leonie. This is a scan that she carried out. And this is looking at a nodule that was found within the jawline. This is the original scan. She looked at the ultrasound and I carried out some work on it there, that CGI work. The blue area is filler, the red area is the parotid, and it's within the SMAS tissue, within an area mid-face. So you can see the problem caused by nodule formation because of injection into the wrong tissue. That really just highlights the interest that you've got in masseter treatment and assessment. What have you found particularly in terms of teeth grinding in patients since lockdown? Have you found that they don't realise they've got it, or is it something that they know they need help with? What have you found in your own personal experience with your dental work?
Look, I just am amazed by it in itself is a pandemic, I believe, of bruxism. When we were in lockdown, we were very restricted with our practice. So we really were limited to seeing emergencies. And, you know, honestly, every day someone would present with facial pain related to bruxism or fractured teeth. And, you know, it's really well documented in all the literature searches now about this psychological association with bruxism and how bruxism has, you know, created a lot of damage on the teeth, and it presents with pain and masseter hypertrophy and bulking of that. So my experience during lockdown, and I have done my own little internal anecdotal study just for observational purposes, but you know, I would say during the pandemic it really increased. I would say about 70-80%. The presentation of patients with pain related to dental bruxism was just overwhelming. And, you know, the amount of teeth that have been either lost, not in my hands, because I'm very much a tooth preserver, but, you know, cracks in teeth. And, you know, what's very classic is patients having that, you know, linea alba, the keratosis in the cheek and the tongue scalloping. So that's kind of how I fell into aesthetics. I always honor that and always reflect on that, because I wouldn't have known this beautiful world of aesthetics had I not have had that experience. But, you know, being able to help patients who haven't had relief of jaw pain by doing a really good multidisciplinary approach to helping them, which does include, you know, splint therapy, physio, and injectables. And I think for me, it's been really interesting to see the masseter muscle, like on ultrasound. The masseter muscle is just such an interesting muscle because you really see how anatomically different it is compared to all the other facial muscles. because all of the other facial muscles are presenting with a, you know, a thin, hypoechoic, for the people who are not understanding, but like a dark layer. And then you see the masseter and it just looks like a big cauliflower. It's so fibrous. It's got so many septi. It's so thick, different bellies, different depths. And, you know, how can we get that right? I'm amazed how we've done it in the past, to be fair. You know, given the anatomy of the masseter, it's such an intriguing muscle and its proximity to carotid.
It's astounding and scary at the same time. I mean, that's where ultrasound comes into its own, doesn't it? You can visualize that, like you just said, it's a thin line, and you can can visualize it wherever it is in the rest of the face. But when you visualize a masseter, and even patients, you show it to them and say, this is your masseter muscle, even they get it. And then, you know, that's where it really comes into its own.
Absolutely. And then when Viv can do the CGI and make all the colors, you know, and I think it gives us so much information, because then there's the phenomenon of, you know, the paradoxical bulging. And then we're wondering, is that the superficial belly of the muscle? Is that the deep part that's protruding? So to be able to visualize that and see that, I just think it's just amazing. I think I just love that I'm still curious.
Yeah.
I get more curious as I get older, actually. And I think just the privilege of education and being able to learn is just, it's life-changing.
What would you say, Martina, for anyone who may be considering the whole idea of using ultrasound in their own aesthetics work? What would you say to them? What would your advice be from somebody in your position who'd never previously come across it, someone who's gone through training and who's now starting to use it? What would be your advice based on your own experiences as somebody thinking about the whole idea?
Well, I think, you know, really 4 months ago, I would have been sitting on the end of this live thinking, gosh, I don't know if I could do that. It's overwhelming. For me, I mean, my concern is the whole technology, and will, you know, I be able to use the machine? But I think they all are very straightforward, actually. And I think the learning curve is steep, but the learning curve it's doable if you're interested. And it is time to recognize images. I don't know whether looking at images all the time, black and white on radiographs and x-rays, whether that's helped me. But I think it's something that you can achieve. I'm certainly no expert at all. I'm still in my infancy of learning, but I can look at a structure. I can look at anatomy on the face. I can map the face, and I can, you know, visualize the anatomy, and particularly with aesthetics. I mean, we're looking at blood vessels and we're trying to minimize harm.
Exactly.
And we're trying to minimize complications. And every time a needle is placed in the face, whether it's in a safe area, there are no safe areas, because anatomical variations are just present in every patient. So I think really to continue to do what we've always done is not good. I think challenging the status quo is always good. I think we have to be advocates for our patients. We have to know that we are actually doing the best that we can for them. And I think give it a go. I mean, it's a very affordable entry point into aesthetics and in ultrasound. And you can actually very quickly realize if it's for you or not. But I think if you're really serious about aesthetics and you're really serious about delivering good results, and economically to the patient actually as well, and if you want to be perceived by your patients and your peers as elevating your aesthetics, I think it's a really good idea.
Really good answer. Really good answer.
It was just one last question, sorry. It was just about the whole fact that we've only really met through social media, Martina. We've never met face to face. I've never known you prior to last year. What would you say? Would you say social media has helped you communicate and keep in touch with practitioners around the world to talk about your experiences of dentistry and facial aesthetics? Do you think it's helped you over the last few years?
Oh, look, it's just been absolutely lovely connecting with, such influential people as yourself. Very inspiring. Both of you, your career is extremely inspiring. And I'm just, absolutely humbled and thrilled that I've been invited to speak with you guys. So absolutely, I think it's been a lovely thing to be able to connect. And I really think for me, social media was something that really took off during the pandemic.
Yeah.
And it's something, sometimes you have a love-hate relationship with it, because it's there's that fear of comparisonitis, and that you spend a lot of time that you could be doing other things. But then there's so many great positives. Like, this has been wonderful for me today. It's opened up a world of information that we wouldn't have had before. And I think it's been beautiful to connect with people. And I think in terms of having it for as a profile for a practitioner, it's nice for people to get to know you a little bit. I think we're always curious. We're always wanting to know what's going on in someone else's life. So I think it demystifies people. I've certainly had a lot of people come through with anxiety, and they come along and they think, well, I've been watching your socials and I think I'm going to be safe here. But it's been a really great experience during the pandemic, I think, to establish some relationships, get to know, as you said, Viv, it's only been about a year, and also just being able to ask questions and see what other people's experience of something has been. It just gives you that little bit, a sense of connection.
Thanks very much, Martina.
I was going to ask on behalf of Viv, actually, and myself, Martina, I would be really interested if we did another live and we focused maybe with a little bit of prep on your thesis and how, especially with lower face laxity, because I think it's one of the tough ones, especially when we're dealing with older patients. I mean, our age and above, I suppose.
Absolutely.
And how potentially marrying that with ultrasound as well to kind of assess the tissues before going in. So I mean, that would be a brilliant live if we could do that.
Absolutely. I'm just in the process of publishing the results. So, lockdown was good in that regard because I spent 4 months researching 350 papers.
Wow.
So I critically appraised, using critical appraisal tools, 302 articles.
Wow.
Well, definitely. I'm sure.
But I thought, let's make the research mean something.
Exactly.
If I had been working, it would have just been doing it to get it done.
Exactly.
But I sat at this kitchen table with my kids, and my work day was 9 to 5, doing my research, knee deep in research. But it's been good. We've had some really good findings. And so we're in the process of publishing that right now. So I think it's a bit of a slow process. I don't think we
would love to hear about that on a live, and perhaps marrying it up with use of ultrasound as well. So that'd be brilliant. Viv, I'll let you wrap up because we
just wanted to. I think we both really love talking to you this evening, Martina, and we've got to thank you for getting up this early hour in Sydney to do this. So we're really very, very thankful for that. Hopefully we'll have a chat again in the future. We'll discuss your master's results and the work you've done in that. And really, just any final words that you'd like to say to anyone watching who's been listening to you, anything that you wanted to say in addition to what we've already talked about?
I think just go out and be your best self. And I think to stay curious and to learn is a privilege. And I think that we should always be trying to do our best. And I think just as a practitioner, I mean, it's just boring to continue to stay the same. We have to be able to evolve. I can't do what I was doing 10 years ago. I can't do that. So I think just constantly try to aspire to be the best practitioner you can be, whatever that looks like for you. But I think the thanks goes to you guys for having me on. I really appreciate it. I've just watched the Sydney skyline get bright. It was dark this morning. I thought my dog might have gone off, but and I must say, I've literally woken up every hour because I was so nervous I might sleep in.
Oh no! Well, we really, maybe have a power nap now before everyone wakes up at home.
No, I'll be heading out the door soon. We'll get the day started.
Okay,
yeah.
Brilliant.
We could talk all night, but thanks a lot for spending all this time with us, Martina, and giving us all this knowledge that you've got. Very kind of you. I just wanted to say we've got next Thursday, a couple of days' time, we've got Professor Mariam Idrissi from Morocco, who's a professor of radiology, and we'll be having a good chat with her about aesthetics and ultrasound, and that's on Thursday the 1st at 8:30 p.m. UK time. But again, Sunny and I, just a big thank you for joining us this evening, Martina, and we'll organise another chat with you in the future, maybe later this year. We'll talk about the work you've done with your masters, and I hope you've enjoyed it.
Loved it.
Great.
Thanks for having me. Enjoy the rest of the bank holiday weekend.
A few hours left, we definitely will.
Okay,
thanks Viv, thanks Martina.
Thank you
Thanks
so
a lot.
Okay. Bye-bye.
See you, Martina. See you, Sunny.
Bye, Viv. Bye-bye.
Bye.